NewVision Health is a software startup. Our mission is to help transform the patient experience at the hospital bedside. We provide fully integrated multimedia patient education, entertainment, and communications capabilities to help hospitals and other healthcare facilities communicate with patients who don't speak English as their native language. I never really considered myself to be an entrepreneur until somebody had pointed out to me one time that everything that I've done throughout my career has been about starting a new division, a new function, a new department, and how entrepreneurial that is. And it's about, taking risk and starting something new and trying to make it happen and bring it to reality. And so when the opportunity came up to work with Anne, we just hit it off right away and realized we really liked each other and we had a common vision, and she made it easy to come along for the ride and take the actual step to be starting a company.
The concept evolved. I have been working on patient information and education materials for a long time, and my background is nursing, so it's been a very long time in terms of my full background. And it's very clear when you are in the hospital or you're caring for someone who's in the hospital that a lot of things need to happen and happen differently. And so we evolved the concept as we were moving along.
So one of the things that happened when I came onto the team was I came with my own personal experiences, and that was that my children were born at Fairfax Hospital and my son was born with a cleft palate. And the doctors kept doing this to me, as birth defects go, this really isn't a bad one to have. And nobody ever gave me some real information that I could act on and deal with while I was in the hospital. So we left, he had a hearing test as required by law, and he failed that hearing test. And every doctor and every nurse knew he was going to fail that, but no one had told me. And so in this day and age, with all the information that exists on the internet, with all the information that exists, and doctors and nurses just being so strapped for time, the desire to communicate that information to me was there, but they didn't have the time to do it. And so they didn't tell me something that I thought was really critical to help.
Working hard.
Selling lots of product and really building value for our investors and for our employees, and more importantly I think for patients in hospitals as a way to help them reduce their risk and increase their revenues and reduce the cost of delivering patient education. We really think that we're in the next 2 to 5 years looking to transform the way care is delivered in hospitals.
And now is the time.